I had to hit the unmute button. So we are recording now, and I want to thank everyone for being here. Randall, I want to thank you for putting this Zoom meeting together. Linda, JT, thank you for all your technical knowledge that you have for the Back on Track and the Knee on Track and the Brain and Body O2. And I want to go into this little commercial as if they would say on YouTube all the time. It's like this, we have a commercial in this little presentation. So what I wanted to do is I wanted to invite all of you that's at this webinar to attend my Neuro Reconnect lower extremity in Conroe, Texas. This will be at ErgoFlex Technology. That's going to be September the 16th, 17th, and 18th. And then also the weekend after that, I'll be flying back to ErgoFlex for a secret seminar, and that will be held the weekend after the Neuro Reconnect. So just so that you know, for the Neuro Reconnect, we're going to be talking about the lumbar spine, the mechanics, and actually how to address lumbar pain, the pain pathways, how to inhibit pain, how pain affects your sympathetic, parasympathetic, nervous system, your endocrine system, your dopamine, serotonin, your catecholamines, not just, we're going to work on back pain. And, how does this impact your heart function, your sleep function, as well as hip mechanics, and actually how to address the neurological connection from the muscles and Golgi tendon organs in the hip to the spine, to the cerebellum, to the brain, as well as knee pain. And wouldn't it be incredible to have a knee pain program where you could get results with 80 to 90% of patients within 1 to 2 visits? And here's the kicker: you only accept those patients that you get results within those 1 to 2 visits, and everybody else has to go. Good news is with the Neuro Reconnect, you can really help more than 90% of patients within those first 1 to 2 visits. And then I can train you how to let patients know if I don't get results in 2 visits, I will not accept you for care. And we'll go through that whole program at the seminar coming up. The seminar that I have has to do with how to do outside talks for knee pain and peripheral neuropathy, how to set those up, how to carry on outside either lunch workshops, or you can do seminars in hotels. Also, how to set up care plans, how to do a neurological exam, and how to look at treating more than just the knee. Because here's one of the things that we're going to go into before. Well, let me just say this, back up. That's what we're going to be talking about at the Neuro Reconnect. It's going to be 20 hours Friday, Saturday, and then a half a day Sunday. Get signed up on that. All you have to do is go to barlowbrainandbody.com, click on register, and you can go straight to that registration platform. I wanted to go over with you some 5 surprising facts about the knee. Now, anyone can experience knee pain sometime during their life. The knee is the largest joint in the human body. Now, this is very interesting right here. 346% of your body weight goes through your knee when you're going downstairs. Okay, 346% of your body weight. So I don't know if any of you have been in Mississippi. How can I say this politely? We've got some adiposity, some adipose tissue hanging out in Mississippi. In other words, we got some fat ass people here. So if you can take that body weight and multiply that times 346 pounds, and you're walking downstairs, okay, well, imagine the number. Just walking, each knee goes through 261% times your body weight going upstairs, 316 times your body weight, and then again downstairs 346%. So some interesting facts right here with this, and which we could correlate this into: do you have problems walking upstairs, downstairs? What's going on? Did you hurt your knees going upstairs, downstairs, those kind of things? And here's the percentage of body weight that's associated with that. Exercise, the most efficient effective management strategies for knee osteoarthritis. So, I always have patients, I tell them, just use your body weight, do squats, okay, walk, and then put some ankle weights on. You can get these at Walmart, and just do leg extensions, then lay on your bed, and then go into a 90-degree flexion, and then go into extension. Now, this is an interesting fact here: is 1 kilogram of weight and I'm no master of the metric system, but that should be 2.2 pounds. 1 kilogram of weight equals 4 kilograms of reduction in load to the knee joint. So there's a 4-to-1. If you look at that, there's a 4-to-1 ratio here. So losing weight means that you're going to put less pressure on these joints, and it's just like anything else, just like in physics. You got stress and pressure and time, and so the joint, a structure only designed to hold so much stress, and you put too much stress on it over time, it will degenerate. And then you look at that, plus then we add into it a cerebellum that's poorly functioning. We're going to have hypotonia in the muscle groups. We're going to have in our lumbar spine, we have 5 nerves that come out. 4 of these 5 nerves control your knee function, and the muscles to your knee. There's 10 muscles that control your knee function, controlled by 4 nerves. And on top of that, see, if you get a lower motor neuron lesion, which means you get damage from the spinal cord ventral horn cell out, which means that we can have inflammation, blood sugar dysregulation. I just got a Cyrex array number 5 back from a patient. He has autoimmunity to the myelin sheath, comes in with neuropathy, and that's a whole different ballgame right there. So, if this guy has an autoimmune disorder to his myelin sheath, it's going to be very difficult addressing his neuropathy till we address his diet. So tonight's talk is going to be really 3 things to avoid when helping people with knee pain. 3 things to avoid. One thing I'm going to highly recommend that you avoid and stop doing is a per visit fee structure. Chiropractors have been doing this since 1895, and look at where it has gotten us. Okay, so you've got to hire somebody, or you got to go to a seminar in which a doctor or a consultant or somebody is going to have to get you out of this fee for visit program. You come in, you pay a fee for a visit. We've got to stop that. We're paying now for a fee for service, meaning that you come in with knee pain, and this is my knee pain program. This is my knee pain financial investment that you'll have to make. And see if you can actually, if you know how to do a neurological exam, you know how to communicate with the patient effectively, they're going to want to do your program because they're in your clinic because they don't want to have surgery. And so what we're going to do is we will set them up with a program, and we'll say we're going to do a neurological exam, and then we're going to do a trial treatment. And if you get results during that trial treatment, we will accept you as a patient. But if we don't get results in 2 visits, we will not accept your care. Is that fair enough? Well, I mean, what is somebody going to say? No, doc, that's not fair enough. So of course it's fair enough. And if you help a patient, then you should get paid a professional fee for that. So stop. One of the things you've got to avoid is you've got to avoid doing per visit fees, right? I don't do per visit fees. Everybody that comes into my clinic is on a case fee program, and I can show you how to do this. As a matter of fact, if you go to the Barlow Brain and Body Institute, Neuro Reconnect, we're going to go over all of that at the upcoming seminar in Conroe, Texas. All right. One thing that you got to stop doing is you've got to avoid just looking at the blinky light. So if a patient comes into your clinic, and I'm going to show you the Barlow Brain and Body Institute, the entire advanced program that I would go through with a patient who had a knee problem. And see, this is why when you don't understand neurology, all you're looking at the damn knee, you completely just miss everything going on with the patient. Because if a patient came in with a knee problem with me, I would do the OPQ. Now, this is everything that most doctors are avoiding, okay? First of all, they just look at the knee and they would avoid looking at anything else, all right? And you just got this weak-ass mindset of a chiropractor that's too damn afraid to ask people for money. I don't have a problem asking people for money, okay? Because, I get up at 3:45 in the morning and I study. And, I don't wait for shit to happen. I make shit happen. And, I know it's cliche, but I actually live that. And I'm trying not to get on too much of a rant here tonight because that's not what it's about. But I'm just sick and tired of bitch-made chiropractors complaining about they don't make enough money And then when somebody comes in with knee pain, they're too concerned about, oh, they can't afford this. Oh, they can't. Oh, well, when did you become their financial advisor? Please let me know that, because I'm confused. I thought you were a healthcare professional, not a financial advisor. And the worst thing you can do is think that somebody can't afford this program. And for most chiropractors, I'll just be honest with you, 99% of you, I wouldn't even want you being my doctor, because I wouldn't want to come into your clinic and you look at me and go, I wonder if he can afford this program. That's not what I'm in there for. As a patient, I'm in there for you to do a head to toe neurological exam, tell me what you find, and let me decide what I want to do about it. Okay. It's really a simple, easy process, but these socialist ass chiropractors, and yes, I'm calling all of you out to a bunch of damn socialists when you're out there worried about what people, oh, they don't have the money for this, they don't have the money for that. No, that's not the way entrepreneurs think. I'm an entrepreneur, and if you don't have the money for that, you can hit the freaking road, and I'll do it in a polite way. But the point is, people come into my clinic because they are mega effed up. And the fee structure is the fee structure. And I'm just sick and tired of these socialist ass chiropractors going, well, if insurance just paid for it. That's a socialist mindset. If somebody else took care of you, you could do this. And I'm like, well, no, these people want to take care of themselves. But again, this just bitch made chiropractor sitting here, this weak ass mindset that he's broke and he thinks everybody else is broke. And that's not the case. Okay. So wealthy people want services that are going to get them better regardless of what the fee structure is. Okay. So number one is we got to stop doing a per visit fee structure. You got to avoid doing that. You got to get you started on a case fee. You got to be able to communicate effectively and do a head to toe neurological exam. Because if a patient came in with a knee pain problem, here's the way I would set this up. First of all, I would look at both knees to start with. Even if they had a unilateral knee pain problem, I would compare right to left, because I don't look just like at the blinky light. I would also look at their lumbar spine. Why would I do that? Because I know that the 5 nerves of the lumbar spine, 4 of those 5 control knee function, the nerves to the knee for knee function. I would take a lateral and a front x-ray. When I looked at the front x-ray here, I'm actually looking at the gastric air bubbles in their stomach, which is going to lead to inflammation. This inflammation is actually going to spill over. These inflammatory cytokines are going to spill over, causing possibly leaky gut, which means it's going to release interleukin-6 cytokines that's going to impact the mesencephalon line. All right, in the process of doing that, these cytokines are actually going to cross the blood-brain barrier and inflame the brain. So now, Mr. Smith, I know you came in with knee pain, but I noticed that you also have on your x-rays some gastric air bubbles, which means you have inflammation in your gut. Tell me about your digestion. It's raining like crazy out there right now, so please forgive me if I've got a metal roof here. All right, so tell me about your gut function, your digestion, your constipation, gastric reflux. And see, your gut communicates with the brain, and the brain communicates with the gut through the vagus nerve. And when you get these inflammatory processes, this can decrease your brain function. Tell me about your focus, attention, and concentration. And if they say, yes, I have that, they're already in stage 2 Alzheimer's. So what I just did right there is I took somebody who came in with knee pain and took them through how's your gut doing, because on your x-rays, there's my x-ray, my digital x-ray right here, of course it's turned off. This would be right here. Okay. And it's coming down outside. So we're going to link the gut issue to the brain. We're going to link the brain to the gut, and then see, we're going to ask about focus, attention, and concentration. They say, yes, I have that. See, if you don't come to my seminars and you don't go to somebody who can teach you this, you don't know that every human being that comes into your clinic, you need to be asking about focus, attention, and concentration. And see, what you're doing is you're avoiding that because you're afraid, oh my God, if I talk about that, I won't know what to do. Or, oh my God, they don't have the money for this. Or, oh my God, whatever. Take your woke ass and check it at the door. Okay. People want to get better. Okay. Don't put yourself in their shoes. Okay. Just be the doctor, do the exam, communicate effectively, look at them from head to toe from a neurological exam, and then you're going to treat what you find. Okay, so I just literally went through with you right there. If somebody came into my clinic with knee pain, how I would loop that from the knee to the gut to the brain to the gut, and guess what happens to the financial investment I'll have to make? Every one of these problems I find, the price goes up and up and up and up. I'm not looking for anything. I'm just telling them what I find. And it's just like if somebody came to your house and you needed to get some reconstruction done in your house and you didn't realize you had termites in a wall over here, and the construction crew said, wow, you got more damage over here than what we thought, and you've got termites, and the investment's going to be this if you want that addressed, or your whole freaking house will fall down. Okay. So again, the problem is you're looking at the blinky light, and you have to avoid just looking at the blinky light. The problem is you've never had anybody that's at this level in neurology to be able to explain it to you this way. And see, you've got a lot of consultants that's just talked about knee and peripheral neuropathy, and that's a great intro. But here's another thing you got to know. The tsunami is already here, folks, and that's Alzheimer's, early onset Alzheimer's, Parkinson's, dementia. And see, I can train you how to detect this information and correct it before it totally and utterly just financially and emotionally bankrupt the family. You got to ask the right questions. People don't ask the right questions. It's one thing that you're avoiding, and you probably don't even realize you're avoiding it. You just don't know how to do it. All right. So, like for example, when a patient comes into my clinic and I go to the OPQRST, and the magic here is I want to know how many doctors have you seen, and then how many have helped you. And of course, the answer is going to be I've been to 5, 6, or 7, and I've gotten 0 help. That's the answer you want, okay? Because they're not in here in your clinic because let me back up. If they're in your clinic, it means that they have gotten 0 help everywhere else. I am not the first stop that 99% of patients make when they come into this clinic. Hopefully I'm the last, but I'm not the first typically, hardly ever, because I don't market to acute pain patients. I market to only chronically ill people, all right? But they have to say this. They have to say, I've been to 5 or 6 doctors. They have to say, I've had 2 or 3 or 4 steroid shots, and none of this has helped. I'm on all of this medication. None of this has helped. You've got to draw that out of them. And see, by avoiding this, because again, you just weak and you just bitch made, I don't know how to wake anybody else up, but just get you pissed off at me, And the point is, these people are here to get better, but you're not asking the right questions. And then you get frustrated because the person doesn't do care for whatever reason. Okay. Now, so we went through, let's see what not asking the right question. Okay, we're going to the OPQRST. How many doctors have you seen? 6. How many steroids have you had? 3. Have they helped? No, none of the doctors helped. Nobody's helped. That's why I'm in here. I saw you on TV. You wrote 2 #1 best-selling books. I want to come into your clinic to see if you can help me. Now, here's the magic. Ms. Smith, I tell them this is a very serious question. Now, I need you to tell me on a scale of 1 to 10, with 10 being so bad you'd be in the bed and you couldn't even function. 1 is you're not in pain at all. All right. What number is your knee when it's at its worst? And you can give me a range. Sometimes they'll say a 7. Sometimes they'll say it might be between a 5 and an 8, something like that, and that's good. All right. Now, once I get finished with this, and another thing, what most of you are avoiding is when people come in with knee pain, is you're not doing a head-to-toe neurological exam, and all of these people at some level have neuropathy. Go down there and look at their toes. Do vibration. Do a digit span test. Do 2-point discrimination. They don't just have knee problems. And because, see, you've never went to a consultant, you've never been to a doctor that specializes in functional neurology, they don't know, nobody knows how to teach you this stuff outside of me. All right. So stop looking at the blinky light. Stop just looking at the knee. Everybody over the age of 45, you need to be looking at their gut, asking about constipation, diarrhea, gastric reflux. You need to be asking them about their focus, attention, and concentration. Sorry, I didn't realize I was putting the middle finger out there. It's just, I don't know what happened there. You got to look at neuropathy, because these people have it if they're over the age of 45 having chronic health problems. Now, here's the magic. On a scale of 1 to 10, how bad is this problem? They're going to give you a number. And then what number do I need to get this to for you to be happy with the results in here? And see, again, because you're avoiding asking the right questions, either out of ignorance or you're just too damn lazy or too scared, I don't know. All right. But see, the problem is you think because you don't ask the right damn questions, you think that the patient is expecting to get to a 1. And very seldom are they ever expecting that. I mean, hell, these people have been suffering for 5, 6, 7, 10 years or longer, and nobody's knocked it in it. So if they come in at a 7 or an 8, and then I ask them, what level do I need to get this to for you to be happy with the results? Almost every time I ask that question with every patient, but the answer is 3 to 4. 3 to 4, doc, if you can just get me to a 3 to 4, I would be extremely happy. I've had people come in here and go, I couldn't even imagine what it would be like to be a 3 or a 4. Now it gets better because I say, if there were a way I could get you as close to a 1 as possible, would you want to know about that? And I don't tell them I'm going to get them to a 1 because, I don't know if I can do that. But what I'm doing is I'm asking them basically, if I throw the kitchen sink at you and I give you everything that I have, all the metabolic care, all the regenerative care with True-Dose PRP, everything that I need to give you to get you as close to a 1, would you want to know about that, or would you want to be a 3 or a 4? Okay. And almost every time people go, no, doc, if you can get me to as close to a 1 as possible, I want to be at that 1. But see, again, you guys are over here just, I don't know what you're doing. You buy a piece of equipment, you go to the seminar, you get a bunch of hoorah-rah shit, and then you get bitch slap Monday, and you're like, oh my God, I don't even know what to do anymore. Okay. And see, you come to my seminars, and I'm going to show you how to communicate. I'm going to show you how to market. I'm going to show your staff how to market. I mean, not market, but answer the phone. I do a 100% cash practice. I'm not going to go over with you how much, but if you call me, I don't have a problem telling you because this is going out into the internet. People need to know about my personal finances, but if you want to know, I will be more than happy to tell you, what I collected last month. It would blow your freaking mind in Tupelo, Mississippi, what we're doing down here. All right. So if you actually want to learn this and you want to learn how to treat somebody from head to freaking toe, and I mean brain, cervical spine, hands, gut, lumbar spine, peripheral nerves, early onset Alzheimer's, dementia, Parkinson's, I'm your guy. I'm doing it in Tupelo, Mississippi. Okay. But you got to want it, and you got to stop just looking at the blinky light. You know what? All of these people that come into your clinic, you got people coming into your clinic freaking tomorrow. You had people coming into your clinic today with knee pain. And because all you did was looked at their knee, you didn't see that they had loss of arm swing, early onset Parkinson's. You didn't notice that they sat here at you like they were looking at you like no facial expression, Parkinson's. You didn't ask anybody because you were just focused on the knee, trying to make a buck. Okay, not looking at the whole person, trying to just pay your bills, hoping you pay your bills this month, hoping this person's going to do care instead of being the damn doctor that they came in and expecting you to be. You didn't ask them about their focus, attention, and concentration. At stage 2 Alzheimer's, do you walk into a room and forget why you walked in there? Do you call somebody on the phone, forget why you called them? Are you in conversation? You forget what you're talking about. Boom, stage 3. And when these things happen every day, boom, stage 4. And when you get into stage 5, you're too far gone. But see, you just want to learn about the knee, and you can make a good living at that. But I'm telling you, all of these knee pain patients that come in, they have much more, they have more health problems than just their knee. They got metabolic issues, they've got autoimmune issues, they got blood sugar dysregulation, and see, you're avoiding this because it will require work. Okay. You're avoiding this because it will require critical thinking. Okay. You're avoiding this because you want somebody to give you a freaking dumbass boilerplate protocol that I could teach my 18-year-old grandson in a freaking day how to do. Okay. We don't have protocols in here. We do the head to toe neurological exam, and we put a person on a protocol that's right for them. So enough preaching here tonight. I got less than 5 minutes, and this thing's going to automatically shut off. So I want to thank everybody for being here. I am going to open up the floor for any questions, And please, if you have any questions, just unmute yourself and just ask the question. I'll be more than happy to answer it, and let's fire away.
Yeah, Andy, can you hear me?
Yep.
Hey, just real quickly, so muscles coordinate joints and cerebellum coordinates the muscles. But when you get down to the knee, what is the pain fibers? Are those in the ligaments that are causing the pain because the muscles aren't coordinating the joint, or is it the meniscus?
Okay, so that's a really good question. Now, what I would like for you to do, Josh, is if you would, I did a pain seminar last weekend, or was it last Tuesday? And so if you would, I went through the pain pathways of the C fibers, A delta fiber, and crude touch fibers. And the thing is with C fibers, not only are they nociceptive, okay, so it could be muscles, ligaments, tendons, the joint itself, but also when it comes to C fibers with nociceptive input, this is going to be impacted by blood sugar dysregulation. This is going to be inflammatory processes, autoimmunity. Those issues are going to play into a part with C fibers as well. And see, this is why the more you understand about the human body, looking at the blinky light really makes no sense, because if somebody, let's say the next person that comes in, they come in with early onset Alzheimer's. So what this person is, the weak link in their neurological or in their system is in their hippocampus. And then the next person that may come in may have frontal temporal demise, which means their frontal lobe is decreased because it never developed properly. But see, the same situation could happen in the knee because somebody had trauma in the knee. Let's say when they were 15, they had a car wreck. Boom, their right knee hit the dashboard. And then see that acute pain subsided. And then over the years, nobody actually addressed it properly. And you've got these inflammatory processes that just keep going and going. And then now you got somebody that's, 50 years old, and now they put on 25 pounds, and then bam, now they hit a threshold of my damn knees hurting all the time. And so what we have to do is we have to look at this multifaceted approach, which is what I do in my clinic. I look at it from a multifaceted standpoint. We have to address every one of these areas that we find. Okay, so to answer your question, it could be the ligament, it could be the tendon, it could be the muscle. Actually, you see what happens too at the Neuro Reconnect seminar that I have next weekend, just simply the muscle spindles or the Golgi tendon organs not firing appropriately into the spinal cord, that can actually cause pain. That's why when we do the Neuro Reconnect system, this is why people get like almost instantaneous results with decreased pain and increased mobility, because what we're doing is we're activating the neurological system to decrease pain at the spinal cord level, brainstem level, and brain, because there's no way that I can actually activate the system and regenerate a joint that fast. So it's got to be more than just the joint deteriorating that's causing this pain. There's a neurological component with that as well.
Right. So resetting.
Yeah, resetting the muscle spindles, Golgi tendon organs. Also doing laser therapy, doing knee on track. Getting that mobility through there. But again, I think what happens is we too many doctors just try to look at things from a monomodal approach. I'm going to do one thing, and I'm going to change this person's life. And if this thing shuts off, I've got less than 1 minute, and it's going to automatically shut off. So, but again, we've got to look outside of that monomodal approach. And part of that came from chiropractic with the one cause, one cure. And if you look at medicine, they have what's called couch postulates, which is KOCH postulates. And what they're basically is the medical realm of one cause, one cure. And these things do help when we have acute care, or like with bacteria, those kind of things. But you can put a bacteria in a petri dish, then you can find an antibiotic to kill the bacteria. And see, there's a cause and effect relationship.